Hello, my name is Karina Alvarez, and today I will be giving an oral presentation on the case study titled New Protocol: How Drugs Rebirth as Treatment for Cancer Fueled Price Rises. This case study is around a prescription medication that was originally used to treat leprosy. Then because of many birth defects associated with the drug, it was taken off the market. Years later, advocacy groups for AIDS were asking to bring this pill back and to have the FDA approve it. What ultimately not for it was not approved for AIDS wasting, but it was brought back as a leprosy drug. Now that pill is it's titled thalidomide, and basically it was approved under some controlled circumstances in order to not have the high rate of birth defects. So with that, they were off. It's called off-label prescribing. Doctors were able to off-label prescribe that pill to AIDS patients. So the off-label prescribing practice basically means that pharmaceutical reps are not going into doctors' offices and asking them to purchase this for AIDS wasting treatment, but doctors are aware that it's something that they are able to do with their patients. So a couple years later, it was discovered that this pill is then suitable for treating a specific type of cancer, which is called multiple melanoma. So with that, the pill at the start in the 90s was costing $6 a tablet, and it increased in price all the way up to about $26, $29, which is an absurdly large amount. And for those that needed to take the pill every single day, it was a very high cost. So with this rebirth, it's not a rebranding, it's a rebirth of the use of this prescription drug medication. Now there's an ethical question, and basically what the whole argument of this case study is as a PR professional, as part of the company that is selling this and distributing this tablet, how would I address the public outcry regarding the current price of the pill? And basically, what are the ethical responsibilities of the company, and what is ultimately more important, the public health, the public benefit, or the financial health of the company? So as a PR professional, I feel that this company needs to, it's a for-profit organization, and just like all other prescription drug medication companies, they need to have a profit. I think it's very emotional and sensitive when the topic that we're talking about is cancer. And if there is a treatment that is attainable by so many people and can cost a low amount of money, a low cost, then why would we not help distribute this at a lower rate? So I think that the company ultimately needs to figure out a corporate social responsibility plan. They need to work with their PR department and their community relations department to address how they are going to reinvest this surplus of money. So as Andrew Carnegie, as Andrew Carnegie argued in his article titled "Wealth," the redistribution of surplus dollars in a way that benefits the overall community is how he feels that money should be distributed. And it's not about inheriting money. It's not about leaving it to a charity as a bequest or a trust or what have you. It's about deciding where those dollars are going. So there are several opportunities that I think the Celgene company or corporation can partner with, whether it be nonprofit organizations, local pharmacies, uh, companies like Family Wise, which is a discounted prescription drug program that's put in place nationally. But I feel that the public, the PR professionals need to do some sort of bridging between the profit outcomes of the company and the needs are as it relates to cancer, to the cancer patients that are actually consuming the drug. Now there is a program in place that were for those that were making under $36,000 and had less than $10,000 in assets. And I think that's great, and that's one step in the right direction, but there needs to be more, especially in Miami, if we want to relate it just back to our local community, because there are, we have a population that are hardworking and deserving, but will make over, they're not under the federal poverty line, but spending $3,000 a month in prescription medication or $300 a month, it's not viable to them. So it becomes a question of how, if we know that that this pill can treat the cancer, then how can we, as PR professionals, put programs in place that will benefit the company. I'm not saying that the company should be giving out this pill for free, but they need to be collaborating with other organizations. So whether the organization subsidize the cost of that pill or do something else, they need to do something like that, and then that will in turn benefit the community as a whole. And when I say the community, I mean the people that need access to this drug. Because if not, as the article states, there are other countries that are producing this pill at a much lower cost, $2 or $3 a tablet. And basically, the people that need this pill will go to another country to illegally buy it and consume it. So as a doctor, would you rather have your patient consume the pill nationally, or do you prefer that they go overseas? And that's really where I think the company needs to create a plan, decide what it is that they want to do. They are making money, and obviously the cost of the pill increased dramatically over a short period of time. So they need to address the issue. They need to address the community that needs access to this pill, and come up with a corporate social responsibility plan to have them have a positive light in the prescription drug world and industry. So in conclusion, I agree with Andrew Carnegie's approach and ethical position to the distribution of the wealth, and how a company like Celgene Corp can use his ethical philosophy and position to better themselves, give themselves a positive light or a positive look in the prescription drug world, and help cancer patients that really need access to the pill. In terms of John Locke's ethical position, I feel that he argues that we have a right to life, to property. So I feel that he would want everyone to have access to the pill, although it's a very difficult article to interpret, because it's very gray and what is the right to property and what is the right to life. So I mean, I think if you're sick and there's something that you can take to make you better, and it's fairly very cost at a very low cost, then there needs to be some sort of tiered program or something in place that can serve the purpose of making sure the company is making money as a business. That is ultimately the bottom line. What they need to do is drive a profit, and that the health of the public good is they just have access to the pill and it's being addressed, and everyone they could be in much better health, and then that these companies that are driving such high profits then invest those dollars in research and development to further science and come up with additional cures and hopefully one day cure cancer.